Hello.
Hi.
My name is Lila and I'm going to be your student nurse today.
Okay.
How are you doing today?
I'm good. How are you?
I'm good. Just going to take a look at your ID. Can you state your name and date of birth?
Lauren Hager, 10/25/2002.
Okay, perfect. So today we are going to be doing a musculoskeletal exam. So I'm just going to be taking a look at some of your joints, your muscle strength, your range of motion with all that. Is that okay with you?
Yes.
Okay, perfect. So patient appears to be light medium skin. She's alert. She's awake. So we are going to get started. Now, do you have any pain? Can you rank that on a scale of 0 to 10 for me? 0 being no pain, 10 being worse pain.
0.
Okay, so patient has no pain. Okay, so I'm just going to start with inspecting kind of the back of your neck.
Okay.
Is there any pain there?
Nope.
Okay, patient appears to have little lump deformity on the back of the neck. We're going to move down to the shoulders. Is there any pain there?
Nope.
Okay. Down to your elbows. Feels symmetrical there. Is there any pain?
Nope.
Okay. Down to the wrist. Any pain there?
Nope.
Okay. Hands and the fingers. Patient appears symmetrical. Is there any pain with any of those?
No.
Okay, perfect. We're going to move down to your knees. Patient appears to have a little bit of crepitus in the left knee. Is there any pain with those?
No.
Okay, I'm going to have you lay back a little bit. Perfect. And do the ankles. Ankles appear symmetrical. They're not swollen or anything. Is there any pain in those?
No.
Okay, perfect. I'm going to have you sit back up. We're going to start to do a little bit of range of motion with all that. So my hand at the back of your neck, I'm just going to have you take your chin to your chest. Okay, perfect. And then back. Awesome. And then take your right ear to your right shoulder. Okay. And then do the other way. Perfect. And then back behind your shoulder as well. So like turn like that. Perfect. Okay. That seems to be symmetrical, no deformities. Okay, so now we're going to do your shoulders. I'm just going to have you lift your arms up above your head. Perfect. And then cross them through past your midline. Perfect. And then I'm going to have you go straight out and up. So like forward, lift up. Perfect. And then go all the way back. Perfect. Okay. Then I'm going to have you take your hands and put them like behind your back like that. Okay, and then like squeeze your shoulders out. Okay, and then take them behind your neck. And then squeeze them back. So feel a little popping in the left shoulder. Okay, so now we're going to move down to the elbows. Okay, and I'm just going to have you flex them up towards you. Perfect, and then back out. Awesome, so I feel a little crepitus in the left elbow. So now for wrist, I'm going to have you bend your wrist back towards you. Crepitus in left wrist, a little bit of popping, and then take them down. Perfect, and then lay them straight out and take your thumbs towards you. And then your pinkies out. Perfect. Now for your fingers, I'm going to have you extend them back towards you and then down to the floor. All right, and then spread them out and then make a fist. Perfect, strong. Now we are going to move down to your knees. So I'm just going to have you lay back again. Perfect. All right, so I'm going to have you extend them out and then back in. Perfect. Everything sounds symmetrical there. All right, now for your ankles, I'm going to have you lift your feet up towards you. Perfect, and then point them towards the ground. Awesome, and then take your toes in towards you. Perfect, and then pinky toes out. Awesome. Everything sounds normal there. Okay, so now I'm going to have you put your shoes on. And stand up for me. Okay, so we're going to start with your hips. Just feeling that they feel symmetrical, everything's good. So now I'm going to have you do a little bit of range of motion with your hips. So I'm going to have you take your right foot, stick it out. Perfect, and then take it back. Good, and then to the side. And then over. Perfect, and then just lift it up and out. Awesome, now we're going to do the same on the left. So left foot out. Good, and then left foot back. And then to the side. And then over. Good, and then up. Now. Awesome. Nothing sounds abnormal there. Okay, so now we're going to do your spine. So I'm going to do the same, hold your hips. I'm just gonna have you do like a little bit of a back bend. Perfect. And then lean towards your right, going down. Perfect. And then towards your left. Awesome. And now I'm gonna have you bend down and touch your toes. Just gonna lift this a little bit. So a patient's spine appears to have a little bit of curvature, and it's a little lump with some deformities. All right, you can go ahead and stand back up. All right, now I'll have you sit back down. We're gonna do some muscle straightening. Okay, so with this, I'm just gonna do your upper arms first. So go like that for me. All right, I'm gonna have you take it in towards you. Good, and then out towards me. Good. And then pull in towards you. Good, and then out towards me. Okay, so patient's muscle strength seems to be at a 5. Everything's normal. All right, is there anything else you need from me?
Nope, I don't think so.
Okay, well,
Thank you.